You're watching CTOM TV. Knowledge is power.
Next question from Frederick. Are clinical trials worthwhile, or am I just being a guinea pig for science?
That's a great question.
It's a legit question.
Yeah, and it's a bit of both, Frederick. So briefly, I'll just describe what the different studies are used for, because there's different series of clinical trials. Now, there's the old standby where, I don't want to be in a clinical trial in case I get or I don't get the drug that I'm supposed to get, or I get the placebo and then I don't get any treatment whatsoever. That typically doesn't happen in human disease trials. What the placebo is in most cancer trials is the normal treatment you would receive for that cancer. That's often standard chemotherapy.
Okay, so worst case scenario,
Worst
Frederick,
case scenario, you get the
care.
standard treatment. Yeah.
Okay.
So phase 1 studies, that's the first initial phase of a clinical trial. And basically that looks at the safety of any device or drug.
Okay.
So, you have to know it's safe before you go to the next level. Phase 2 looks at the efficacy of the drug. In other words, does it actually work at the cancer? And then phase 3 are typically more of a, let's see how it works in specific cancers. And they typically involve randomization and let's test this drug against standard therapy and let's see what the survival is and the progression-free survival.
So the first is really how safe is it?
How safe is it? Yes.
Yeah, and then the second is how well does it work? Really,
how well does it work?
In contrast to standard care.
Exactly. And then the third one is, the application of it compared to standard care, for example. And in that study, you take a group of patients that will have the drug plus standard chemotherapy, and a group of patients who will just have the drug alone without the standard chemotherapy, for example, or some other combination. And they'll compare these two arms. And then, in phase 3, they typically look at what we call response rates. So that's the percentage of patients that respond who are on the drug.
Okay.
And a response can be a complete response where all of the tumors respond, a partial response where some of the tumors respond, stable disease where the tumors don't grow and they don't shrink, or progressive disease. And that's where the drug doesn't do anything. That's called the RECIST criteria, those different responses. But stage 3 looks at those 4 different responses and determines what the response rates were. They also look at how many people progress on the disease at a period of time. That's called the median progression-free survival. And so the progression-free survival is, let's say you have 100 patients. Once they reach the point of when 50 of those patients have their disease recur, then they call that time the progression-free survival. So let's say it's maybe 6.6 months. The overall survival is the same thing, but it refers to, when 50% of those patients die. And these are called the medians. Median is a halfway point. And then once you have those statistics, and these statistics are the currency of cancer treatment, you always want to know these statistics, the response rate based on RECIST criteria, progression-free survival, and overall survival. And there's a bunch of other things they look at, like the disease control rate, things like that.
This is all in phase 3.
All in phase 3. They're used across the trials. I mean, they can be used at any point. And then you have the phase 4 trials. And those are basically post-marketing trials where the drug's been approved and they want to see how it stacks up compared to other drugs, competing companies and so on. And, try it with different combinations of drugs and so on. So the 2 types of tests you look at are open label and obviously blinded. And so you want to be in an open label.
You mean, when you say tests, you mean clinical trials? You could have an open label
well, they are
trial.
Tests. They're basically tests.
Yes, but we don't know your lingo, my friend. We're trying to learn. So there's the open label clinical trial or the blind clinical trial. Okay, and what does which mean?
So the open label means the investigators and the patients know whether they're getting the placebo or the drug.
Okay.
And blind obviously means that nobody knows until after the trial.
Okay.
So the gold standard has always been blinded. And the reason for that is if you take a open label clinical trial and you see this phenomenal result in these patients, and it increases their lifespan, then all of a sudden you have to somehow say to these patients who are on the placebo, sorry guys, the guys on, the people on the treatment drug are doing really well, and you guys aren't doing so well. Thanks for the input. Obviously, they can't do that. So what they have to do is something called a crossover. And the crossover means, okay, we know that the drug is really working well. And so all of you people in the placebo, we can't really use you for data anymore. So we're just going to switch you over to the drug and you can get the benefit of the drug. And so that kind of ruins the study, but it's the ethical thing to do.
I would think that proves the study.
Well, it proves the study, but then you can't get an accurate determination of how much that drug benefits these people.
Oh.
So, you don't want to use people as a petri dish. So that is why the blinded trials are kind of considered the gold standard, but they're not very ethical.
Issue. Yeah.
So, I always recommend going an open label. There is another option. What you can do is if you're taking an oral medication, you can go out and you can get that drug tested. You can get mass spec on that, and you can see if you're getting a sugar pill or an actual drug. So
you do your own research and find out if you're on the placebo or not.
I would say that that's frowned upon, but hey, if it's a life and death situation, this is your life.
Yes, that's true.
I would be doing that if it was my situation.
So is it ever the case where, because you said, okay, baseline for everybody's going to get the standard care, and then some will have the new treatment added on and others won't, essentially.
Right.
So would there ever be a circumstance where being on standard care hurts the outcome of the test? And I don't just mean confounds the ability to tell how well it works, but stops the new treatment from working as well?
No, that is a very interesting point. I'm not aware of a lot of studies where that's the case. What it can do, and this is typically where trials are often stopped, is it can cause a lot of side effects. So in other words, the standard care plus the tested drug can cause so many side effects that the patients can't continue. And in those cases, usually what they do is they stop the trial. They don't continue with it. It's stop for toxicity.
Sure. So then how would they know then whether it was the combination of the two or this drug that doesn't work?
Well, they would look at both. I mean, they look at what's called the adverse events, and you have 4 different classifications of adverse events. And so if you have a lot of adverse events, grade 3 and 4 adverse events, that means you require hospital intervention, and the patients just can't take the drug anymore.
Right.
So it's not something where I'm just feeling sick or I have diarrhea. These are serious issues that need hospitalization.
So it's not likely that you'd have a kick-ass treatment, but it's just the standard chemo is preventing it from working functionally.
That's unlikely. I'm not saying it's never happened. Trials can, that anything can happen in a trial.
But as a rule, Frederick, probably don't need to worry about that.
No, but look for an open label test or open label trial. And, I wouldn't, if it was a good drug and I knew that I had the marker for it, I would enter a phase 1 or a phase 2. You don't have to restrict yourself to phase 3. The problem with phase 1 or 2 is that they're not geared for statistical survival rates. They're more for safety, but I mean, if you get a good response in the drug and your tumors start evaporating on a phase 1 trial, there's a good chance they can allow you to stay on that drug after the trial.
Great.
Thank you for watching Ketome TV. Subscribe below and stay informed.